I'm RJ Sudha, your host for this special series called Behind the Scenes. Behind the Scenes intends to cover some remarkable stories from our country and globally in your future. Today, once again, I have someone special with us. We have Dr. Pradeep and his patient Prateek Khandelwal. Dr. Pradeep is a physiotherapist, applied nutritionist, and yoga practitioner. And Prateek Khandelwal is no more a definition of patient. He is an inspiration model for so many. In this recent past, I have been introduced to Prateek showing incredible results with spinal cord injury. We are here to discuss how Dr. Pradeep and Prateek played an important role in each other's lives. So thank you to both of you for joining us on this show. I have few questions for Dr. Pradeep to start with, and later I have one small question from Prateek. Okay, so thank you so much once again to both of you.
Thank you.
Thank you. Thank you. So what are the challenges you face when treating a person having a spinal cord injury? This is for Dr. Pradeep.
See, spinal cord injury rehabilitation involves not only a patient, it involves the entire family of that patient. The first challenge I usually face is to make that patient as well as the entire family the concept of recovery and rehabilitation, because it's a completely different rehabilitation approach to bring a person who is paralyzed or who is in bed to bring him back to the function or independence. So the family education is a huge thing to make them. It's a huge challenge for me. The second challenge is I always call this approach as a psycho-intellectual approach. What does that mean? The more the patient understands what exactly the therapist is asking him, or regarding the exercise part. Here the exercise is completely different from the normal strengthening. It is basically developing control over the body parts. So the more the patient understands, the easier the patient do the exercise, and the recovery is also better. So making them understand the concept of recovery is a huge challenge in front of me. And the other challenge usually I face is answering a lot of questions, like the duration of recovery. There are many things comes from the patient as well as from the family. To answer these questions are also very difficult, challenging for me.
Right. So if I could understand correctly, spinal cord injury is more of like it could make a person paralytic from the spine, which is, I think, from the bottom of a lower back. Is that correct?
Exactly. The spinal cord is an extension of a brain, which so right from the base of your skull, the brain extends down, and it is called a spinal cord. So injury can happen at any part of this spinal cord. It can be at the base of the skull to the base of your lowermost part of your spine, and it can lead to a different degree of paralysis.
Right. Thank you so much for educating on that, on the part of spinal cord injury. Is it possible to show recovery after a nervous system damage for which there are no proven medical solution?
See, that is a point I want to make very clear to everyone. See, not proven cure for spinal cord injury. From the rehabilitation aspect, it is very difficult to accept that term, because the spinal cord and the nervous system is an highly dynamic system. It keeps on changing. The more the challenge you put to the system in the right way, the nervous system starts responding to you, and you will find a varying degree of changes in the body. So it is the more the therapist, it's all in the hands of a therapist and his expertise and knowledge how we can challenge this nervous system which is compromised due to any kind of accident or injury, and bring the best out of the nervous system. So it is that statement that there is no cure, that is not very not a proper way of addressing a spinal cord injury. There is also the spinal cord changes, and we see a recovery. And Prateek is one of the examples that now he has reached the considerable changes of independence in his day-to-day activities. So we can make a lot of changes. People with spinal cord injury, it's not the end of everything.
That's an amazing response I would have ever expected. Okay, so a lot of patients must be asking you, sir, this is again for Dr. Pradeep, when will I walk, or can I walk, or what would be your advice to these kind of patients entering to your rehab program?
See, it is very difficult to say in the beginning that you will be able to walk and you can walk. The entire process of recovery and rehabilitation is not yet decoded. That means we don't have any standard protocol in addressing such kind of in spinal cord injury. So it's difficult to say. It is also a big challenge for me to answer this question to anyone who asks me that what time I will walk or how long I will take to walk. It's very difficult to say initially. But one thing I can assure them that whatever the stage they are, I can make the body which is below the level of injury more functional and which is more useful to them. So that the part below the level of injury won't become a burden to them. Rather, it become more useful, and they can it will help them in their day-to-day life.
Thank you so much. I mean, it gives me some hope to know that there is no end once a person is a victim of spinal cord injury. Lastly, but not the least, Prateek, this is for you. Okay, what would you advise people who sees no ray of hope after the spinal cord injury?
I think a lot of people want to get back on their feet right after a spinal cord injury. What they need to realize is that unlike other injuries, like you have a fracture or some other injury where recovery is a matter of few days, weeks or months, people need to understand that recovery from a spinal cord injury is a far more complicated process. And for certain people, it might take a certain years, and for others, it's a matter of lifetime. But recovery is possible, and my advice would be to everybody that they should enter into a right exercise or rehab program, because that till now, as far as my knowledge goes, it shows improvement. And while entering into a right exercise program, it is very important to learn to manage your other internal body functions that have gone wrong. It is very possible to manage your hyperactive bladder, your bowel system, your sexual challenges, your spasticity. These are issues that people face on everyday basis, which really brings their quality of life down, and hence they start remaining depressed. So my advice is that while you enter into a right exercise program, you learn how to manage all these things that have gone wrong, so that you don't have a UTI, you don't have dextrose, you learn to manage your bladder, you have digestion. All these things are possible, and that is how people should learn to manage a spinal cord injury, right exercise program, and right way to manage the other things that have gone wrong.
Thank you so much for sharing hope in the midst of the crisis. With this, I would want to check with Dr. Pradeep. Dr. Pradeep, there would be so many people out there who may not know where to reach out, who can give them some kind of a hope, right? When they have many difficulties. Would you be interested to share your details with our listeners who can reach out to you when they feel that there's no way they can get back on the feet?
Oh yes, anybody can reach out to me. I can, many of the patients do that. They call either from India and abroad, and I give them an online consultation. I give them online guidance about the spinal cord injury and what needs to be done. It's a comprehensive management, as Prateek has said, what needs to be done during further recovery and the management of the complications. are involved. So anybody can contact me. My contact number is 919686613856.
Thank you. So that helps some of the victims can always reach out to Dr. Pradeep, okay, for the treatment in near future. Okay. Thank you once again to both of you for your precious time.
Thank you so much, Sudha.
Thank you. So tune in for special shows like Behind the Scenes and follow us on Facebook, Twitter, Instagram, and LinkedIn for multimedia awareness. This is RJ Sudha signing off from the special show called Behind the Scenes. Stay tuned to Radioactive and Get Active. Thank you.
Thank you.